Half of Victoria's population, that's more than 2.6 million people, are in work. And of those 2.6 million workers, 1.2 million have poor diets, which are high in fat, 1.6 million do not exercise, and 1.6 million are overweight or obese. And we know that workers with a chronic disease or at risk of developing a chronic disease are more likely to be injured at work. And with that in mind, I want to announce new action which our government is taking to make our workplaces healthier and to make them much safer. This new action, the Work Health Initiative, is genuinely a world first. Work Health will, over the next 5 years, give every worker in Victoria, 2.6 million men and women, the opportunity to be screened for their risk of developing a chronic disease such as diabetes and heart disease. And it will support workers who are diagnosed as being at risk of developing that chronic disease. Work Health is the first program in the world to target the connection between chronic disease and workplace injury across an entire workforce. Work Health is a practical extension of the National Reform Agenda's goal to boost our national productivity by making our workforce healthier and safer. It'll take 5 years and cost $200 million to screen every workplace, and it will guide at-risk workers towards the programs and the treatment that they need. Screening will be voluntary. It'll be up to individual workers to decide whether or not they want to be screened for their risk of a chronic disease. And likewise, if any worker is identified as a risk, that information belongs to them, not to their employer. And the privacy, obviously, of all of those screened will be strictly confidential and strictly protected. With this announcement, we're extending this international leadership to the workplace. The first state to do it, and I believe this will be a world-leading initiative. Victoria is already the best part of the best place in the world in which to live and to raise a family. But we also want Victoria to be the healthiest and the safest place in which to live and to work. And that's why I believe that Work Health will in fact prove to be one of our government's best ever investments.